Hey, I'm Jess, and I get a lot of questions about this, so I want to explain the benefits of getting lymphatic drainage before and after surgery. MLD, or manual lymphatic drainage, is appropriate for most any type of surgery. This is because our goal is to reduce inflammation and scar tissue while assisting the body's naturally recovering and restoration processes. Getting MLD before going into surgery simply helps prepare the area for the procedure. They say that the best indicator in surgical outcomes is how healthy the surgical area is to begin with. We aim to help the recovery be smoother with less pain, swelling, and bruising, with greater mobility and speeding up your body's own filtration systems through MLD. This can result in cleaner, healthier tissue for your surgeon to operate. Imagine a doctor making an incision into clean, well-drained tissue versus tissue that's already been inflamed. I just had a client a couple weeks ago who had a full hysterectomy along with liposuction and breast reconstruction, and that's a lot of surgery for someone to go under at once, but when I called to check in on her, she said that the hardest part was remembering to rest because she felt so good the week after surgery. This stuff really works, and I'll explain to you why. Imagine you need to go and have your knee replaced. By the time you get to the point where you're needing to have a whole joint replaced like that, the integrity of the tissue around the knee is going to be pretty shot. The knee may already be swollen, and there's certainly going to be some tissue damage surrounding that joint, and you're just dealing with a lot of pain and inflammation. Now, we know that the stronger that you're going to go into the surgery, the stronger you're going to come out of the surgery. This is why physical therapy is often prescribed before going into surgery as well as after, because we want the strength and stabilization of the joint to be as good as possible before going into surgery. This makes physical therapy so much easier and more effective on the back end. Without managing existing inflammation before surgery, you're kind of setting yourself up to be overloaded with inflammation, swelling, restriction, and pain during the recovery process. By doing lymphatic drainage on the knee just a few times before you're going into surgery, we can address and calm down the aggravation and inflammation. We do this by intentionally massaging the knee. We can clear out any extra fluid or cell debris, preparing the area both for the procedure and for the healing process that's to come. This results in better than average recoveries. It's a significant portion of our clients that we work with, and they do really well with their recoveries. We generally recommend having 2 lymphatic drainage sessions before surgery, the first being about a week before, and then another session just 2 or 3 days before surgery. We don't generally recommend doing MLD within 48 hours of your surgery, the reason being that we want to give your body the time to process the work that we did, and you're just going to get more benefit out of it if we can get our hands on you a few days before versus just a few hours before you go in. But what lymphatic massage is best known for, and is really maybe the most important reason to have lymphatic drainage in conjunction with a surgical procedure, is to help swelling go down as quickly as possible. This helps to manage pain, and it maximizes the healing effect that inflammation brings. You see, the reason we swell so much after a trauma is to provide the damaged tissue with a flood of oxygen and nutrients. But once that fluid's been used, it's really important for it to get evacuated out of the area, removing cell waste and debris along with it. The fluid's now ready to be replenished, and the process can start all over again. This is how better drainage to and from the area can help speed up healing, and lymphatic massage can really help facilitate this process. Inflammation is a very important part of the healing process, but it's vital that we keep it in check and don't let the swelling sit there stagnantly. And that's what's disrupting the healing process and contributes to the joint becoming stiff and painful, is that swelling just sitting there around the joint. There's many different ways to manually help the lymph system. Lymphatic drainage practitioners use a variety of techniques that are all geared towards reducing swelling and preventing and releasing restrictions that may form in the affected area. Adhesions are also common after surgery, so we want to make sure that your tissues don't adhere together, which can cause long-term discomfort and motion issues. It's so helpful after surgery to work with a knowledgeable practitioner to make sure that your adhesions aren't forming and that the scar tissue is as flexible and mobile as possible. And finally, the best thing about lymphatic massage is how extremely gentle and nurturing this work is. It's truly a healing modality, and kind of when you need it the most. We always recommend talking with your doctor about your specific needs for treatment, but most patients are good to start within about a week of their surgery, and you just want to be sure to ask your doctor about this stuff. If your doctor doesn't already know about it, tell them about it. And I really would love if we could all work together to help normalize pre-care and post-care for surgical patients so we can get better outcomes all around. Okay, you guys, I'm Jessica Johnson, and thank you so much for your interest in lymphatic system, and I hope you found this helpful. Thanks.